Good evening, wider BVI and persons listening regionally and also internationally. As a young boy, my grandfather, the late Honorable Prince Stout, told me stories about the deaths of over 942 persons due to a cholera outbreak in the BVI in 1853. I once overheard a conversation between him and his brother, the late Honorable Hamilton Lavity Stout, as they described the sinking of the Fancy Me on July 26, 1926, when almost 60 persons died at sea on a voyage between the Dominican Republic and the BVI. I remember their reflections like it was yesterday on how those two incidences impacted the entire population of the BVI and literally tore at the emotional fabric of every family. While the Virgin Islands history books speak of this type of pain through deaths, I never thought I would live in a time when I too will speak to an event that has ripped at the emotions, spirit, and will of our territory, as COVID-19 has and continues to do. In the past week, I have made several personal calls to persons and families impacted by COVID-19, including families of public officers who've died. None of those calls, however, were as emotionally challenging as making a call 3 times to a friend who lost 3 siblings. BVI, I understand that families are hurting. Children are also hurting. You are hurting. And I am also hurting. This is the reason why, outside of what is my normal day-to-day role, I am using this platform to speak to you this evening. I have termed my brief words this evening as a call for unity through COVID-19, a call for unity through education, love, and hope, a call for unity through COVID-19, a call for unity through education, love, and hope. Let's speak about a call for unity through education. As recorded, COVID-19 has claimed over 4 million lives globally, more than 600,000 lives in the United States, over 150,000 lives in the United Kingdom, upwards of 1.3 million lives in Latin America and the Caribbean, 1.3 million lives in Latin America and the Caribbean, and 23 lives in our very own BVI. Of the persons that died in the United States, the CDC reported that 99.5% were unvaccinated. 99.5% were unvaccinated. Of the 23 persons who died and left ripples of hurt in our very own BVI community, 100% were unvaccinated. Of the persons who were hospitalized as a result of COVID-19, all except one or unvaccinated. One thing that is also accurate, most persons who were sick and ended up in specialized care units have died. BVI, physical and emotional pain is present in our small and fragile community. Global research, confirmed by our very own acting chief medical officer, Dr. Ronald Georges, records that while vaccination does not eliminate your chances of contracting or transmitting COVID-19, it does something that is special and remarkable. Vaccination severely reduces the transmission of COVID by up to 75%. Vaccination reduces the risk of contracting COVID-19 by between 60 and 90%. Do you know what it also does? Vaccination practically eliminates severe disease, long-term complications, and being admitted to the hospital. Basically, vaccination practically prevents you and I from dying. Vaccination can stop you from dying. It can stop you from dying if you contract COVID-19. BVI, vaccination can prevent your mother, father, spouse, friend, pastor, teacher, or your children from dying. And lastly, vaccination can stop some of the most amazing souls in the BVI from dying. Therefore, vaccination is our best chance of living and working with COVID-19 in the Virgin Islands. Vaccination is our best chance of reducing the pain in our community caused by COVID-19 sicknesses and deaths. Global research, which has been also confirmed by Dr. Marjorie Yiseng, has highlighted that persons with normal chronic illnesses should be the first to be vaccinated because their risks of severe illnesses and deaths are significantly higher than others. Please, BVI, consult your doctor and get vaccinated. Also, vaccines never enter the nucleus of your cells where you find your DNA, and therefore do not alter your DNA. But BVI, don't take my word for it. Don't take my word for it. I strongly recommend you explore sources for information from reliable organizations such as the World Health Organization, Centers for Disease Control and Prevention, Public Health England, Caribbean Public Health Agency, and Pan American Health Organization. Over the past week, with the great efforts, approximately 125 persons that I know personally decide to give themselves a fighting chance of living through COVID-19 by being vaccinated. I thank them and the many volunteers who assisted with the recent drives. They joined and has made a total of 15,620 persons that have been fully vaccinated, 10,810 that are partially vaccinated, for a total of 26,501. BVI, we are well on our way, but we have more work to be done. I make a special plea to the 2,600 public officers. Our vaccination numbers are too low. They are too low. We've already lost 3 employees. And you all know we've been significantly impacted daily by persons who test positive or have been in contact with someone who has. While we've made a strong commitment to serving our clients and our services continue, any day now, this could be altered. Please, please, give the public service the best chance by becoming vaccinated. At this time, I also make an urgent plea to our law enforcement agencies. Your vaccination rates are also too low. You are our defense, and we trust you. But unless you are protected, you cannot protect yourself, and you cannot protect us. I offer my time and my energy to work with you and converse with you so that our law enforcement agencies can be better protected. As your deputy governor, I am fully vaccinated, and I am 100% convinced that the vaccine is the best hope we have in the BVI to reduce the impact of future stories about COVID-19 that I will have to tell my grandchildren, as was told by my grandfather about the cholera outbreak and the sinking of the Fancy Me, where the BVI lost lives. Let's transition now to a call for unity through hope. BVI, there will be persons who, for health and other reasons, will not take the vaccine. They too are our family, friends, and coworkers. They too deserve to be cared for, advised, engaged socially, and work for a living. Research shows that the best protection against being significantly negatively impacted by COVID-19 is by taking the vaccine. Research also shows that persons, regardless of their vaccination status, must follow strict protocols of wearing masks, ensuring proper hygiene, such as washing your hands, and practicing social distancing, for example. All of us must ensure that we do those things. As I conclude the conversation about a call for unity through love, BVI, I want to have a real and honest and personal conversation with you. As a territory, we have done well. But from the bottom of my heart, I believe we can do better collectively of showing love, compassion, understanding, and bringing all persons along with us on this COVID journey. This responsibility does not only belong to the government. This is a responsibility of all persons living and working in the BVI, because we're in this together. I am not sure, but whether through fear or ignorance, Some persons have used their personal beliefs about COVID to ridicule some, limit fundamental rights, create isolation, and unfortunately promote fear. COVID-19 BVI and its impact cannot be used to advance personal agendas, divide the so-called intelligent from the ignorant, or divide a community that has just demonstrated its ability to care for each other after the devastating hurricanes of 2017. BVI, no one wins here. No one wins. A call for unity through love is necessary. No one wins if we do not practice BVI love at this time. So this requires me, as your deputy governor, to also be reflective. This requires pastors and teachers to be reflective of our roles during this time. This requires you, BVI, to reflect on your own circumstances. Because one thing is apparently true. If we do not practice unity through love, the pain that comes by way of COVID illnesses and deaths does not discriminate, BVI. It hits the vaccinated just as it does the unvaccinated. It hits the conspiracy theorists as it does the well-informed. It impacts my grace, my sanity, your grace, your sanity, and also hope, just as it does the other person's. The reason why I had to mention this is because I was not the first public leader to take the vaccine, but persons were patient with me, offered me information, allowed me to research. But you see, I had visible time in February and March, but now the call is different based on the space that we're in. So if you love and care for persons who are not vaccinated, engage them daily with calmness and facts. You will get through to them. Encourage persons, however, who will not take the vaccine to eat right, exercise, practice limited interactions, and follow all of the COVID-19 protocols. Just like the BVI did not give up on me, and I did not give up on family members and friends, and the 125 and the hundreds who came out over the past weekend and to date, you should never turn your backs on the wider BVI community. Finally, as I conclude, I will speak about a call for unity through hope. A call for unity through hope. This call is, however, direct and personal to pastors and priests, counselors, teachers, mental health professionals, motivational speakers and voices, coaches, mentors, service organizations and clubs. Notwithstanding the pain that we're going through, we need to speak about the future. We need to provide hope and inspiration. When we issue notices about the COVID-19 information, send a positive message to help someone get through. Engage your social groups. Do it remotely. Talk to people. Inspire them. Let them know that we will get through this. And we will get through this through education, love, and hope. I conclude my words this evening entitled A Call for Unity Through COVID-19. A call for unity through education, through love, and through hope. By offering a prayer of gratitude and strength for the governor, the premier, the cabinet, and all the men and women of the House of Assembly who have guided us with the policies and direction for the country related to COVID-19. It has not been easy. The Minister and Ministry of Health and Social Development, the Chief Medical Officer and his team, Permanent Secretaries, Health Emergency Operations Center, and all of the health professionals and support staff in the hospital, nurses, doctors, orderlies, cleaners, administrators, and those on the ground, public officers in the Department of Information and Public Relations, those in media, and others throughout the BVI doing their part. Service organizations, community volunteer groups, businesses, and the everyday citizen who are playing an active role in helping the territory to live and work with COVID-19. Thank you all. Thank you all. You've done an exceptional and excellent job. We will get through this one day at a time, and we will get through by being compassionate and understanding. As I conclude, I would like to end with a moment of silence for the parents, spouses, children, siblings, cousins, friends, and co-workers who we have lost to this dreadful virus. May their memories forever remain in our hearts and in our lives. I thank you very much for listening to A Call for Unity through COVID-19. A call for unity through education, love, and hope. God bless you, BVI, and these strong and resilient Virgin Islands. Thank you.